So as a counselor, as a therapist, one of your main goals is going to be, and difficult goals, is helping clients to adhere to the antiretroviral regimen. A lot of research has shown that whereas clients are usually on board in the beginning, as soon as they start feeling better, they stop taking their meds. Almost analogous to, let's say, someone who's bipolar, has schizophrenia. As soon as they're feeling better, a big problem with treating those clients as well is for them to stay on their meds. So that's one difficulty. And self-report is the main primary way of evaluating. So if a client tells you they're taking them, you basically have to take them at their word, even though the blood work may come back, hey, you know, Colin, can you work with this client or talk with him because his viral load is really low. We don't really think he's adhering to the regimen. And how do they clinically in terms of blood work? So again, as a therapist, our main role, or the way we find out, is self-report. We can only basically trust what the client's telling us. But clinically, through blood work, they look at the level of HIV RNA, or how much is exactly in one's cells. Look at the T cell and lymphocyte count. Look at the clinical condition of the patient and resistance testing. Because a lot of times clients with HIV, in terms of their muscles, will be weak and the resistance low. So helping clients with adherence. So what are some ways we could help our clients with adherence? Well, the first thing is not to shame a client, which I know you probably already know that. But just to reiterate that. And ask questions that give a client opportunity for missed doses. So instead of, why didn't you take that dose? You know, instead of getting into the shame, blame, and guilt, let's more look into the solution. What doses are the hardest to remember? Or what doses did you miss? And then do more of a normalization and adherence problems for honest communication. You know, try to reframe it such as many people have problems adhering to taking their doses of antiretrovirals. What's your issue, or where do you think you get hung up? It's too late and I forget, it's at night. Well, then maybe let's have you take it in the morning. Or in the morning I'm rushing out the door, so then I forget and then I don't take it. Okay, so then maybe it's at night. Or, I don't know, there's so many pills, I can't keep track. Well, let's get a pill holder that separates them all. It's really easy and convenient for you to know what time and when to take certain medicines.